So the UK government have said that they want to try and make 5 billion worth of savings by 2030 by making cuts to services, to payments that affect the poor, the working class, some of the most needy, the disabled, and those that really need the support the most. So today I want to talk a little bit about that and share some of my thoughts on it. So in the last few weeks there's been a lot of media coverage around the PIP, which is the personal independence payments, which a lot of disabled receive, and people that need that extra boost, because those payments allow people to go to work, they allow people to live their lives, they allow people to have support, care, have that financial boost which gives them access to services that allow them to live the life they want to live. Not everyone, we're all born different, and we all get dealt different hands in life, and some of us need that extra support more than others. So I think it's pretty underhand of the government to be looking to clamp down on these payments, and part of it comes from this kind of notion that mental health's been overdiagnosed, and too many people are being diagnosed with disabilities and mental health issues of different natures, and at the end of the day that's being done by health professionals. That's your GPs, that's your specialists. They're the services that are diagnosing. They're the ones that are making our society more aware of the problems that everyone's facing, and not people like me and you. We're the ones that are just going, look, we've got this going on, and they're saying, yeah, you've got XYZ going on here, here's some medication, did you know that you qualify for this support, or let's put you on a training program, let's give you therapy, you're not fit to work. That's not me and you saying that, that's the health profession that's saying that. And this comes off the back of the COVID pandemic, when we had a raft of media coverage around different crises, around education, around the youth, and what that means for their future, with them not being able to take exams and not being able to have kind of progression steps because so much was on hold, and what the pandemic meant for our mental health, because a lot of us lost our freedom for years. A lot of people died, a lot of people's lifestyles and support systems were just taken away in so many ways, and a lot of people have just not got back to living the life that they were living before. So the fact that so many people have got mental health issues now isn't a surprise at all, given what's gone on. There's been so much disruption, and so much of that was kind of forced disruption, with companies folding, being told not to go to work, just life circumstances. Everyone needs to make money, everybody needs to be able to support their family, support themselves in some kind of way, and all we're all trying to do is that right now, and whatever we need to get there, to be able to do that, if there are services and there are payments and there are ways for us to receive support, then we're going to make a claim to get that, because that's going to help our life. Why wouldn't you? And so the fact that we've got this mental health kind of crisis going on isn't a surprise, given the pandemic and all the coverage that there was this sort of looming crisis going to be happening anyway, all the backlogs with the NHS that we've had around operations, around staff shortages, Could go on about Brexit. There's so much overlap with everything that's gone on, not to mention the government, bloody Conservatives, and now Labour, which are kind of like a Conservative light anyway, really, as far as I'm concerned. They're really not coming across like a party for the people right now. They're looking to make cuts. They're looking to challenge people on how they live their lives and what they need in terms of support. And it's ridiculous. Like, they're getting all these politicians on different media channels and just talking about people being overdiagnosed, and like they're a medical professional being able to diagnose this kind of stuff. Like, they just know. It's like just headlines. It's ridiculous. And disabilities and mental health issues are serious, they seriously impact people's lives, and you can't make this stuff up. People don't go around lying about their mental health. People don't go around lying that they have a disability. Like, that sort of stuff just doesn't exist. So what planet some of these politicians are on, to think that people are fiddling the system, I don't know. Like, honestly, it's ridiculous. There's so many other areas that they could be going after, which would save them more than $5 billion. And I think it's low-hanging fruit for them going after this, to be honest. I really do. Especially with all the money that the Conservatives have burnt over the last 10 years plus. That things that they've let go as well. It's... And we've had all these cuts to services over time. I mean, look at Sure Start, which Labour ironically started all those years ago, that Conservatives cut. We've had all these cuts to youth clubs, to access to facilities, to support for young people in our society, and that needs to come back. People need stepping stones. People need support outside of their family home. People need outlets. We need to have more of that, not less of it. And all these cuts to PIP and support services that are there for helping people have a better quality of life, I don't understand how that can be seen as beneficial, like it's a service that's no longer needed. And if we're overdiagnosing for disabilities and mental health, they talk about, I feel like we're getting on the Donald Trump sort of saga here, going on about autism being ridiculous. But yeah, I just don't agree with this at all. I really don't. So we need to see some change. And all these politicians just seem so tone deaf to the backdrop of what's been going on over the last 5 years or so in our society. Honestly. So I'm someone I feel like I'm fairly new sort of on the scene a bit with my own mental health and disabilities. And I'm going through that process at the moment, actually, of applying for PIP. I don't have that depth of experience with that process, but I've heard a lot about how in-depth it is and how that you have to be reassessed, and it's such a degrading process that people go through around it, because there's so much around what you're not able to do and not enough focus on what you can do. And as I say, I'm part way through the process at the moment, so I can't speak from my own experience on that, but perhaps that'll be a video at a later time, at least for 2025 anyway, what that process looks like. So watch this space on that one. I'd love to hear as well your thoughts on PIP and what the government seem to be wanting to challenge right now around mental health and disabilities, and how it's affecting you, because I think it affects us all individually, but collectively we're all in the same boat here with fighting for that need to have our own independence and just to live our lives, you know, comfortably as we can, in the best way that we can. That's all that we all want, really. So drop a comment down below and let's share some experience here. I think it will be a good thing. And if you've liked this video and want to hear a little bit more from me, check out my channel. There's a lot of videos on there covering similar topics and a big focus on mental health as well. So I'd love to see you back again. Alright, take care.